Ujjwala Dev, and today I would like to discuss with you a very common treatment which is widely used by dermatologists as well as frequently requested by our patients. So that is a chemical peel. So what is a chemical peel? So a chemical peel is nothing but a simple outpatient procedure where we apply a liquid or a gel to your face and we keep it on for a couple of minutes. Sometimes it can even be kept on your face for a few hours, and then it is either neutralized or it is washed off with plain water. So what are the conditions which can be treated with a chemical peel? They are as follows. Number 1, oily skin. Number 2, acne and pimples. Number 3, pigmentation of the face in the form of melasma or any spots which remain if you had any infection or any injury. Number 4, it can be used for rejuvenation of the skin if you have early signs of aging in the form of fine lines or a dull complexion, a lot of open pores, then a chemical peel is very helpful. A chemical peel can also be done to treat deeper lines or very severe signs of aging, which a lot of patients have. A chemical peel can also be used to treat acne on the body, on large surface areas like the back or the arms, where it is not possible to apply creams or gels on a regular basis. So you may benefit with a few sessions of a chemical peel, which will help your acne heal faster. In fact, a chemical peel can also be done for pigmentation over the body. If you have a lot of tanning on your arms and legs, if you've come back from a holiday where you spent a lot of time in the sun and now your skin looks dark, you can go for a chemical peel as well. So these are the most common reasons why people come for a chemical peel or doctors recommend a chemical peel. What are the different types of chemical peels which are there? So chemical peels can either be in the form of liquids or they can be in the form of gels. Chemical peels have different composition, so they can be either a single acid like the AHAs or the BHAs, which are the alpha hydroxy acids, or the beta hydroxy acid. So it could be a simple peel containing salicylic acid for if you have oily skin. It could be glycolic acid if you're mainly looking for pigmentation or for treatment of early signs of aging. And peels can also be a combination of a few of ingredients, commonly AHAs and BHAs, along with retinol, certain actives, peptides, azelaic acid, etc., to make it a cocktail of different ingredients which act on different conditions that you're seeking treatment for. So those are basically the different types of peels which are there. Like I said, some of the peels are washed off immediately, some of the peels can be left on for a little longer. So that will be decided by your treating dermatologist and the kind of skin condition that you have. Okay, so are there any precautions to getting a chemical peel? Yes. Before getting a chemical peel, your skin should not have any active infection unless it's acne. Then peel can be done even if you have active pimples. So there should not be any history of herpes on your face, on the lips in the previous 10 to 15 days. Your skin should not be burnt. You should not have undergone any cosmetic procedure like waxing or things like that on your face, which can make it more prone to developing a burn. The peel may penetrate a little more, so those are the things you need to be careful about. Other than that, a peel is a very safe procedure if you're looking to rejuvenate your skin with very little short time. Are there any complications of getting a peel done? Usually none. If you get a peel done from certified dermatologist, a professional dermatologist, then the chances of getting a side effect are much less. But recently a lot of people are getting peels done from untrained individuals. That can lead to a complication. You may develop severe burns on your face. A lot of people try and do peels at home, which at a concentration which is generally not advised. That can lead to burns on your face in the long run. So if you're not doing peels at home or you're not getting it done from an untrained person, in general peels are a very safe option to rejuvenate your skin, get rid of the oiliness, have a natural glow just before an important event. So yes, a peel is the workhorse of a dermatology clinic and it gives beautiful results. And how long does it take to see results? A very important question everybody have. So there are some peels like the lactic acid peel, which is commonly used in party peels, will give you an instant glow because it adds the instant hydration to your face. So yes, it will depend on the kind of peel that you're getting. So if it's a kind of a party peel or something that is very light on your skin, then yes, the results are almost instantaneous. For other conditions, let's say you have a lot of acne, so along with your the medicines which you're taking for acne, your peel works along with that. So it helps the pimples heal faster, dry out faster. It helps the spots on your face to go away faster. So you can expect to see results within 2 weeks of getting a peel done, and it's usually sustained. And yes, so that is approximately how long it should take to see visible results after getting a chemical peel done. So another question is, will you need multiple sessions? So yes, just like anything on your face, because the skin is constantly renewing itself, you need to get a few sessions done initially. So it'll be decided by a dermatologist, but on an average 4 to 6 settings are recommended in the initial setting, so that you get the optimum response, and then you can maintain it with the maintenance peels. That is also there. You can also maintain a peel by using lesser concentration in your home care routine. That is also an option. So yes, you will need multiple sessions if you're looking for a lasting glow or a lasting effect, or a more or less permanent solution to your skincare concern. And yes, I guess that is a lot of the things which I discussed about getting a chemical peel. And if you've never tried it, if you're curious about how a chemical peel should be, then my advice to you would be to try lactic acid peel. It's one of the gentlest peel, and all of us can do with a little bit of moisture to our face. Hyaluronic acid is very much in the news. Everybody is using hyaluronic acid serums. So if you want a little something extra, if you've got a special day coming up, and you've got a special event coming up, or in general your skin just looks dull and you're not happy with the way that your skin looks, then you can try a lactic acid peel as your first step. And for all of you who are having acne, very oily skin which is not responding to treatment, or your treatment is like the treatment that you're taking for your pimples is taking a long time to show results, try and get a salicylic acid peel done from your dermatologist. It usually gives very good results. Your pimples will heal faster. It is generally safe. So are there any who cannot get a chemical peel done? So some of the key peels which should be avoided are specifically salicylic acid. For people who are pregnant or who are breastfeeding, we do not recommend them. But even those like during pregnancy, you cannot take a lot of medicines, and a lot of people do get acne when they are pregnant. So if there's nothing else which is working for you, then you can also get a peel done. But the peel, the type of the peel will be determined by a dermatologist, by your specialist. So you can get in touch with your dermatologist regarding that. So overall, I feel I have covered everything regarding chemical peels and what you can expect from a session. And if you have any further questions or queries, then please let me know in the comment box below, and I will try to address them in my next videos. Thank you so much for watching, and see you next time.